The term hyperpathia. The term hyperpathia, which includes the following. Term hyperpathia. Hyperpathia. What do you think is the correct answer? A. Is it hypersthesia? B. Allodynia. D. C. Hyperalgesia. D. All of them. This hyperpathia term encompasses all phenomena described as by hyperesthesia, allodynia, and hyperalgesia. So the correct option here is D, all of the above. In Dejerine-Roussy syndrome, the lesion is in A. Spinal cord, B. Brainstem, C. Thalamus, D. Cortex. Now the lesions affecting thalamic VPL nucleus or adjacent white matter produce a syndrome of persistent, unrelenting, unilateral thalamic pain called as Dejerine-Roussy syndrome. So the lesions affecting. So correct option here is spinal cord. What is the prevalence of epilepsy? A 2 to 6 per thousand, B 3 to 9 per thousand, C 4 to 20 per thousand, 5 to 30 per thousand. It is 5 to 30% per thousand. Non-motor manifestation of focal seizures can be. Non-motor manifestation of focal seizures can be. A. Sensory. B. Autonomic. C. Emotional. D. All of the above. So what do you think is the correct answer here? You can WhatsApp me directly on the given number for any doubts relating to the PG entrance preparation or INACT. You can also click the link in the description box to join my 3-day unbelievable ultimate Neetpg blueprint masterclass. So non-motor manifestation of focal seizures can be. What do you think is the correct answer? Is it sensory? Is it motor? Is it emotional? The focal seizures can have motor manifestation, that is tonic, clonic, and myoclonic movement, or non-motor manifestation, that is sensory, autonomic, or emotional symptoms. So the correct answer here is D, all of them. Which of the following gene for various epilepsy syndrome is associated with severe mental retardation? A. CHRNA4, B. KCNQ2, C. SCN1B, D. double cortin. It is double cortin. Gene associated with Unverrich-Lundborg disease is A. CSTB, B. DEPDC5, C. EPM2A, D. LGI1. So what do you think is the correct answer here? Gene associated with Unverrich-Lundborg disease. It is CSTB. Which of the following statement about Lennox-Gastaut syndrome is true? A. Multiple seizure types. B. EEG shows slow, that is less than 3 Hz spike and wave discharge. C. Impaired cognitive function. D. All of the above. Now what happens in Lennox-Gastaut syndrome? It includes multiple seizure types, slow, that is less than 3 Hz spike and wave discharge, and impaired cognitive function. So the correct option here is D, all of them. Now, characteristic of Landau-Kleffner syndrome include A. Auditory agnosia or word deafness, B. Normal hearing, C. Abnormal electrical brain activity, D. All of the above. The correct option here is D, all of them. Gun barrel vision is best related to. Now, this gun barrel vision is best related to A. Hanton syndrome, B. Balint syndrome, C. Claudet syndrome, D. Wallenberg syndrome. What happens in Hanton syndrome? Rarely only peripheral vision is lost and central vision is spared, resulting in a gun barrel vision. So the correct option here is Hanton syndrome. CADASIL is due to mutation in which gene? A. Notch 1, B. Notch 2, C. Notch 3. It is Notch 3. Pentobarb comma refers to A comma due to accidental ingestion of barbiturate, B comma due to barbiturate given for induction of anesthesia, high dose barbiturate for refractory elevated ICP, any of them. It is high dose barbiturate therapy for refractory elevated ICP is termed as pentobarb comma. Polycystic lipomembranous osteodysplasia with sclerosing leukoencephalopathy is also called as A. Nasu-Hakola disease, B. Motohashi Shinohara disease, C. Akai Tatishi disease, D. Nakamague Shioi disease. It is Nasu-Hakola disease. Now, PI, polycystic lipomembranous osteodysplasia with sclerosing encephalopathy, is also known as Nasu-Hakola disease, is autosomal recessive disease due to mutation of TYROBP, and TREM2 that are expressed in microglia and osteoclast. There occurs delayed differentiation of osteoclasts and microgliosis, resulting in imbalance of bone remodeling capability, leading to bone cyst formation, inflammatory and immunological imbalance, resulting in brain atrophy and dementia. So it is Nasu-Hakola disease. Which of the following procedure is used for correction of TGA? Mustard procedure, B. Senning procedure, C. Rastery procedure. I think all of the above. All mustard procedure, Senning procedure, they are all correct option. Tarenfluorbil and semaglutide are A. Estrogen analogs, B. Vaccines, C. Gamma secretase inhibitors, D. HMG CoA reductase inhibitors. Tarenfluorbil and semaglutide. This tarenfluorbil and semaglutide are gamma secretase inhibitor. Their use is being explored in autosomal AD treatment with a hypothesis that they would diminish the production of AB42. So the correct option here is gamma secretase inhibitors. Dementia pugilistica is related to which of the following? A. Non-convulsive seizure disorder. C. B. Transient global amnesia. C. Chronic metal exposure. D. Recurrent head trauma in professional boxers. It is recurrent head trauma in professional boxers. Familial Parkinson disease is associated with mutation of which of the following gene? A. PINK1 gene, DJ1 gene, B. Parkin, and D. All of the above. It is PINK1, DJ1, and Parkin. Which of the following about Kufor-Rakep syndrome is false? Now, what is Kufor-Rakep syndrome? Kufor-Rakep syndrome, KRS or PARK9, is a rare autosomal recessive form of nigrostriatal pallidopyramidal neurodegeneration caused by ATP13A2 gene mutation, presenting as juvenile onset Parkinson's disease. Rapidly progressing symptoms of Parkinsonism, spasticity, supranuclear upgauge, paralysis, facial finger mini myoclonus, visual hallucination, oculogyric dystonic spasm, and dementia, usually noted between 12 and 16 years, leads to severe motor handicap. So the correct form answer is supranuclear upgauge paralysis, facial finger mini myoclonus, ATP13A2 gene, autosomal recessive form of this. So correct option here is all of the above. Not all of the above. It is it is question. Read the question carefully. It is false. It is given. So all are correct. This is none of them. Correct option is none of them. The oral agent that reduces dyskinesia while improving Parkinson features is A. Selegiline, B. amantadine, C. bromocriptine, D. pergolide. It is amantadine. Swollen axons of Purkinje cells are called as missiles, torpedoes, gun barrels, cannons. They are called torpedoes. Which of the following is a gene for isolated dystonia? It is all of them.